The Pittsburgh Poison Center is seeing an increase in calls related to kratom and a chemical known as 7-OH. Many of these products are sold at smoke shops just like this one. Now, federal health officials are calling for the restriction of the sale of these products.
The Pennsylvania Department of Health reported back in August that its poison centers were seeing an increase in calls regarding the consumption of kratom and 7-hydroxymetragenine, or 7-OH. According to reports made to these centers from 2022 to this past June, Allegheny County had the most cases at 18. The State Department of Health recorded 38 unintentional and undetermined drug overdose deaths where kratom or 7-OH was a contributing factor in 2024. Kratom is an herbal substance from a tree native to Southeast Asia. It contains compounds such as mitragynine and 7-OH, which have stimulant properties and can have sedative effects. Currently, one must be 21 or older to purchase kratom and 7-OH. These products are completely legal to sell and have no federal drug restrictions on their production. Medical Director of the Pittsburgh Poison Center, Joshua Schulman, said kratom and 7-OH can mimic the withdrawal effects of opioids.
The rise in the number of available products, kind of predicts that people are going to start using them more for, purposes of maybe recreational use. Maybe they're using it for a reason like detoxifying, but they can actually. We've seen people become dependent on the kratom itself.
Schulman said 7-OH is approximately 10 times more potent than mitragynine, which is about 13 times more potent than morphine.
I've heard of teenagers having withdrawal who typically, would not be using opioids. And so it's kind of a interesting, phenomena. I say interesting just from like a new epidemiologic threat in substance exposure.
The FDA recommended a scheduling action in July to restrict certain 7-OH products under the Controlled Substances Act. This act would create a closed system of distribution of 7-OH, increase security for storage of the products, and establish penalties for anyone violating these provisions.
For people who are struggling with 7-OH use, with opioid use, there are a variety of treatment centers that are run by addiction medicine boarded treatment providers who can guide them to more kind of legitimate methods.
The FDA's Drug Enforcement Administration is reviewing the recommendation on restricting 7-OH products, which would need a public comment period before the approval. Reporting for the Pittsburgh Media Partnership, I'm Erin Ute.